Dr. Martinez, adults who have 1, 2, or 3, whatever it might be, not too badly, nevertheless slightly crooked teeth in front of their mouth. I know that there are definitely 2 major options. I want you to shed some light on it a little bit. One is do some orthodontic work, even these days called Invisalign, and barely visible and really kind of good looking and not extremely cumbersome in terms of doing it. And then, of course, you could grind those suckers down a little bit and flap a few tooth nails, as I call them, on it. You know what I mean? Put some lumineers on it. Put some veneers on it, whatever it may be. Tell us the advantages, disadvantage. Tell us a little bit what you would recommend here and there. Is it just a personal opinion? Like I like a station wagon versus a 2-door, and as long as you know what I mean, that actually there may be a reason why I need a station wagon. 6 kids and all kinds of things to haul, and being a gardener, a station wagon may be a lot better than a 2-door Mercedes. But it might also be just a matter of macho, and that's what I like. You know what I mean? Most of us in America drive a SUV, not necessarily because we need it, but because, I don't know, think it's macho. So go ahead and tell us.
Sure. There are a lot of options that we have to straighten these front teeth that are crooked. And you mentioned one of them being an aligner, such as Invisalign. Or you said orthodontics, like brackets, braces, and that's another option. And then you also mentioned veneers or lumineers. It really is dependent on what is best for the patient. I will always present a case to a patient as to what is best. The good thing about things here is that you have options, as we mentioned in the beginning of this.
Sometimes too many. Those options sometimes confuse us.
Exactly. And they do. But you know what? This is where I think a dentist, a good educator, comes in and explaining to the patient all the possibilities that they have. Aligners such as Invisalign are a very, very good option for patients, adult patients that want to have straight teeth, do not want to have any restorations placed on their teeth, are willing to go through the treatment time that is needed to get their teeth straightened, are willing to wear the aligners as prescribed, but don't want to have the braces. So we do have that option.
Which is usually what? Which is usually we're talking anything between 6 and 12 months, give or take.
Yes, give or take for adults for Invisalign is about 6 to 12 months, depending on the
severity of the case.
Of the severity. And then you have brackets. You have your normal brackets that you can get on the teeth, and as well, it's the same. Usually, depending on the severity as well, is the length of time that they're going to wear the brackets. Adults usually don't want to wear brackets. They want straight teeth, but they want the option of the aligners. Or they don't want to wear anything for 6 months to a year, and they come in asking about the veneers and lumineers. I'll tell you my philosophy is
that would be me. Get it done today. Okay. Get it over with. Even though it probably costs a little bit more money, and it obviously has some disadvantages, as shocking, Rooney. I mean, you are undergoing an operation where with an Invisalign, I don't know whether that qualifies as an operation, invasive or not. I don't think so, does it?
No, it's not. No, it's not considered invasive, but it is considered a long-term treatment. And we are in the day and age that we want instant gratification. And if veneers are going to give me that in 2 appointments, you know what? I'd rather have 2 appointments. Or people have an event coming up. They got engaged and they're getting married in 6 months, where they're not going to get the result from the veneers, and they want their pictures to be. From the Invisalign, so that they want their pictures to be perfect. Then you're talking about veneers. One of the advantages of having from your traditional veneers and your lumineers, and you mentioned that, and the reason I need to specify this is that lumineers, typically, you don't have to touch the teeth, and that is probably one of the reasons I like doing lumineers, because you don't have to grind the teeth at all. With lumineers, the technology is so advanced that it is a great product. I've done many, many cases of lumineers where it is awesome to see the before and after, because it truly looks like one of these magazines that you've seen on TV. Before I started working with Lumineers, I used to think, oh, they have to be enhanced or they have to be somehow photoshopped or something, but it's not. I've done my own pictures, and it's truly, truly amazing. And again, one of the biggest advantages for me as a dentist is that you don't have to touch healthy tooth structure to give you that great smile with Lumineers.
Because if you do touch a healthy tooth structure and you grind it ever so little, the tooth literally can go into shock. A little bit like I remember my father not being too pleased seeing me carving, I love you, well, I did it in German, so not in the English language, into a tree. And he says, look, he says, that tree can die. You just hurt it. And, I'm sure some 100-year-old tree might not die because of it, but nevertheless, he got the point across. And the tooth, apparently there's no real forecasting of once you grind a tooth, whether it will wither away or not. Is some truth to that?
Sure. It's, it's kind of like any other part of our body. We have a tremendous capability of healing ourselves, because we're always going through trauma. When we're working out, we're walking, we're creating a lot of stress on our bones, but our body just repairs itself all the time. The teeth, once you grind away on the enamel, and depending on how much you grind away, you don't get it back. So you don't have that healing process, but you do have that mechanism of the nerve healing itself. But again, that's I want to point out my personal philosophy of it is that that's one of the reasons I like doing Lumineers, because you don't have to touch the teeth at all. Or,
can you still shape?
I would say 1 out of 10 patients, you'd have to kind of cut a corner, like a little sharp edge, and I've had to do it where it's maybe sticking out a little bit further than I needed for the thickness of the porcelain that's going to come from the veneer. But it's been very rare where I've had to adjust the teeth. So what happens is this. Let's say that the patient comes in and says, you know what, I want Lumineers. This is the way I want to go. And we do it. Well, the advantage is that you don't have to grind the teeth away. And let's say that the patient 6 months later, a year later, says, you know what, I don't like the way my teeth look. I want to go back to what I used to have, which is, that it really doesn't happen. But if it's okay, you can remove them because you didn't touch the tooth structure underneath. Whereas with traditional veneers, you have removed tooth structure. You cannot go back to what you had before. Mm-hmm. So you will always have to have a veneer or some sort of protection on there.
Right. Now, what about if the teeth are, uneven? You touched a little bit on that. Some tooth might be having something sticking out. But let's just say they're, a little more uneven. Can you still do it with Lumineers, without grinding? Are they adjustable enough to be able to do that?
Yes. Actually, that's the beauty of Lumineers, and that's really why it was made. Lumineers was really made for... The technology was created for people that had teeth that were rotated a little bit or gaps in between the teeth, beautiful enamel, healthy enamel, but just rotated and didn't want to go through braces. So the Lumineer, the porcelain and the Lumineers creates the illusion of everything being nice and perfect. And that is usually why we have to do a very thorough consultation, because we really have to see the space that we have in there to create the most beautiful balanced smile. I can probably bet that a lot of these movie stars out there is what they have in their mouth right now. I wish I could see before and afters of a lot of these movie stars, and I could probably bet that they have some sort of Lumineer or veneer in their mouth, because they can't be that lucky and just get perfect teeth and perfect everything. So obviously they have something done. And the beauty of it is that people, just regular people like us, can have it done. You don't have to be a movie star and pay, a super amount of money to get that smile. It's affordable. You can do it.
Right. It looks like the way you talk about Lumineer, it reminds me of, part of my life has been in the hotel business with some of the best chefs around the world. And as over the last 20-some years, more than that actually, I'm already more than 20 years out, but before that, as there came some pre-cooked foods out, like be it a sauce or be it a particular thing, every, high-class French chef was sneering at it like there is no tomorrow, like, oh no, that stuff, I need to make my own thing with my own, and on they went, till in many, many, many cases it's proven that they themselves couldn't differentiate between the made one and their own made one when you blindfolded gave it to them. And so the veneer thing, because I hear lots of dentists sneering at Lumineers and say, well, I need to make this whole thing my own custom type of stuff, and it reminds me a little bit of that. Kind of like, look, there's new technology out there, somebody came up with something great, use it because it's for the benefit of the people you serve, in this case your patients.
Exactly, and that's exactly why I really love Lumineers. I like dentistry, and I don't know if you can tell I'm very passionate about dentistry, but Lumineers has brought that area to people where it can be done in those 2 appointments, like most people want to have things done, and you don't have to touch healthy tooth structure. You can have beautiful straight teeth in 2 appointments, and it doesn't hurt because you don't have to cut any tooth structure. You don't have to numb anybody up. It's in and out, and it's really a great procedure. One of my oldest patients that had it done, she was 84 years old when she had Lumineers done, and we did 8 Lumineers on her teeth, and she just loved them. She just, to this day, we see her, and she's probably 88 now, and we see her every 6 months to get her teeth cleaned, and she just loves them. And she says, I always wanted straight teeth all my life, and now that I can have it without having to go through braces and the whole thing, and I can afford it now, I'm going to do it. So we did it, and she's happy.
Wonderful. So lots of options. Actually, the 2 major options for a little bit of crooked and not so good looking teeth is Invisalign. Yes, there are braces, but most adults would choose the Invisalign, and or flap some fingernails on it, tooth nails. And the thing looks good, and you might get away without having to even grind and inject. It might just literally be like going to the finger. To the spa. Absolutely great. Thank you very much, Dr. Martinez.